Hello, this is Dalmani's Assisted Living and Memory Care Caregiver Training. If you're in the classroom or viewing this video, you're going to learn the important fundamentals of caregivers and how to safely provide care to our residents. Welcome, welcome, welcome. We cannot say how thankful and grateful that we are to have you with us today, that we are so excited that you have decided to become an important part of Dalmani. As a caregiver, you are a very important part of our residents' everyday routine. They depend upon our caregiving staff for all of their ADLs, which is activities of daily living. During today's classroom training, you're going to learn who is Dalmani Assisted Living and Memory Care, policies and procedures of the caregiver, hand hygiene, PPE, that is personal protective equipment, contagious viruses and diseases such as COVID-19, residents' rights, the aging process, special needs of the elderly, recognizing signs of illness, fall prevention, incident reporting, bed sores and bed care, how to safely transfer residents from bed to chair using different techniques. You will also learn this on the floor during your on-the-floor training with a training caregiver. Psychological needs of our residents, recognizing the signs and symptoms of Alzheimer's, understanding memory care and their behaviors, and then good nutrition. Topics that you're going to get on the floor, and this is typically done over a course of a 2 8-hour shift. The first shift you will be strictly with a trainer. It might be one of our senior caregivers. It might be with somebody on our management staff. The second day you will be given a small group and observed to see how you handle the new skills that you have learned. But during your floor training, you're going to receive shift responsibilities, importance and techniques of personal care, housekeeping and sanitation principles. Now bear in mind, yes, we have housekeepers, but it's everybody on staff's responsibility to ensure that we are constantly cleaning our residents' rooms, common areas, to help avoid the spread of germs, care and supervision needed, activities, mental and physical stimulation of our residents, especially our memory care residents, timely reporting, bed sores, and bed care. So this is where you're going to learn how to apply what you learned during this training video. So who is Dalmani Assisted Living and Memory Care? Our mission: to dedicate each day and treat our residents like family by providing individual, compassionate, and attentive care to all seniors as possible, regardless of their financial background or their social situation. Our Stockton campus was started with one purpose in mind: to give a second chance to individuals who might not otherwise get one. Through our work with the Assisted Living Waiver Program, also known as ALWP, we are able to serve the underfunded seniors of our community and surrounding areas. So here in our Stockton campus, we have many individuals who have faced homelessness, family abandonment, have a history of some form of maybe mental disorders. They have faced drug issues, alcohol issues, and they require our patience and understanding. We also have a beautiful Pacific Grove campus. This one is a 50-bed facility where our private pay individuals go. Unfortunately, they don't participate in the assisted living waiver program because it's not an approved county with the state of California. But however, it doesn't matter if you're at our Stockton campus or our Pacific Grove campus. All of our residents are treated equally and the same, and we should never be able to tell the difference between the two. Policies and procedures of the caregiver. So this is a job description, and it is in your new hire paperwork. And we're going to just go over it a little bit. You're going to act as a shoulder in times of the personal distress of a resident. If they're crying, if they're upset, you're going to take that moment to be there for them. Keep in mind, a lot of them no longer have family that come in to support them or haven't had family in a very long time. You're going to help transport the residents in their wheelchairs to and from the dining room, activities, all that fun stuff, back to bed at night. You're going to help provide documentation in our Outbreak software. Or right now, we are still, during the time of this recording, using the hard paper charts. Or if the charting system goes down, you're going to go back to that paper charting, which is something that you will learn during your on-the-floor training. Now, one key thing about documentation, bear in mind, if it didn't get charted, if it didn't get written, it didn't happen. So in the court of law, if we were to be pulled into court because family had concerns about care and you didn't document that a bath was given, and even though you know you give baths to your residents every single day, if it's not charted, it didn't happen. Keep that in mind. You're going to greet visitors and direct them to the residents' rooms. You're going to help develop a positive bond and relationship with all of your residents by engaging in meaningful conversations and interactions. Keep in mind, you might be the only family that they have. After medication and classroom training and approval from the director of case management, director of nursing on MedTech training, you might be required from time to time to assist in medication management as needed. You're going to report to the MedTech or the director of nursing. You're going to report to the MedTech when you're on overtime, or the director of nursing, or resident care director, or someone that is in management. Now, if you're asked to stay over overtime, it's a little something different. You're going to complete 20 hours of required training. This is a requirement by the state of California's Department of Social Services. You're going to also complete 20 hours on an ongoing basis throughout the year for a total of 40 when you're first with Del Monte, and then 20 each additional year. So what that means is every time that we have an in-service, it is extremely important that you attend. Each in-service is worth 2 hours of credits for your ongoing training. And so if we have one a month, that gives you 24. It gives you a little wiggle room. But if you miss one, you might miss important updates on the building. So make sure you attend all of your required in-services. Perform other duties assigned by MedTechs or Del Monte senior leadership on duty. So number one thing we got to keep in mind when we're providing care for our residents is every aspect of the care is everybody's responsibility. At the end of the day, it is going to be your responsibility to make sure all residents are happy, safe, and healthy. So if you're asked to do something, please do it. If you're unsure or feel uncomfortable, ask additional questions, ask for additional training. We will never ask you to do something that you're technically not allowed to do. And if you are ever in that situation where you feel like you're being asked to do something that you shouldn't do, ask an immediate supervisor, ask somebody in management. assist the residents with their ADLs. So what are ADLs? That's bathing, dressing, oral care, all the little tasks that we all take for granted when we get up in the morning. Our residents depend upon us to ensure that those are done. Now, keep in mind, some of our residents, we have to take a different approach on ADLs. We don't ask them, would you like to take a shower? We say, it's time for a shower. Because given an option, many of our residents, because they're afraid of falling, maybe they had a bad experience before during a shower time, they're going to probably say no. So when it comes to the basic ADLs, changing clothes, showering, doing oral care, you let them know it's time to perform those tasks. Now, residents always have the right to refuse, but a lot of times refusal happens because of the way we worded the question or the task at hand. We're going to assist residents with eating. We're going to help them make sure they get their food trays delivered. We need to make sure all our residents get down to the dining room. We need to encourage every single resident to be up and out of bed at each and every single mealtime. We do care for individuals who are on hospice services. That's a little bit of a different role. In those cases, for our bedbound individuals, you're going to assist them with feeding. You're going to allow them to take their time, chew real slowly, make sure they get plenty of sips of fluid in between to make it easier for swallowing. There is never an excuse for a resident never to be fed if they are a feeder and bedbound. If you need to take an extra 15 minutes to ensure that they're fed, ask for assistance from your teammates to help with other tasks that are at hand. You're going to also observe their condition. So if there's a change in their mental or physical status, alert a med tech, alert the director of nursing, alert memory care director, or the assisted living director. You're going to also, from time to time, assist the residents with their vitals. So if somebody needs a blood pressure or temperature or an oxygen reading, you're going to assist the resident in obtaining those sets of information. If it's after hours, the doors do get locked, so you might need to check on the doors and respond to memory care door alarms. And this next one is really important. This one is everybody's responsibility, not just housekeeping. We're going to make sure the rooms are tidy and common areas around the facility are clean. We're going to help make sure our residents' beds are made so that way at the end of the day they got a nice bed to come back to. We're going to wash and fold laundry. Laundry is set based upon days of the week per resident. Keep in mind, if there is a foul odor coming from the room, such as urine or bowel movement, and it's not that resident's laundry day, what should we do? I think we should still go ahead and wash that laundry. Sometimes our residents are starting to be incontinent, and they weren't incontinent before, and they might hide that dirty pair of underwear, soiled bed linens, and before you know it, that odor fills that room, and it fills the hallway around there. So, always do laundry if it is needed. We're going to also make sure we're disinfecting all the common areas, rooms, and doors, and all that. And then the residence room is free of trip hazards, books, papers, all that fun stuff, off the ground. Now, housekeeping does do a great job, and they clean on an everyday basis, but we have to do our part to ensure that our building is always ready to be shown to anyone who wishes to tour our facility. After medication class, you're going to learn how to do med orders and stuff like that. The reason behind this is in the event of an emergency, such as a mass evacuation, we might have to separate into groups, into different areas for safety purposes, and you'll know how to read the medication orders and how to safely give those meds. Or in the event that, let's say all of our med techs unfortunately are sick with COVID, what happens is we will move caregivers into med tech roles, and then we will resource caregiving from outside agencies. So it's really important that you learn how to do both. Now, you might not be a full-time med tech, but maybe you later on want to move into a permanent med tech role. This is going to help you to know your clients before you move into that position. So that's why we're having many of you start off as caregivers. You're going to ensure that the resident is comfortable when they're in their rooms. You're going to attempt to resolve any issues. You're going to be compassionate with them. You're going to, make sure that during their ADLs that you're accountable for checking the resident's room. So even on our residents who are fairly independent, once a shift, you need to go into that room and check that room for any safety concerns or odors that might be resonating. The caregiver is also responsible for changing the residents who are incontinent. This is every 3 hours, but to be honest, it is as needed. So, meaning if you're caring for Mrs. Smith and you notice Mrs. Smith has a urine smell to her, change Mrs. Smith. Reason being is that if we leave Mrs. Smith in that incontinence brief for too long, she could develop a UTI, which could be potentially deadly to a senior. So every 3 hours you're going to check them, but there should never be an excuse why a resident is left in a urine-soaked brief. So keep in mind, if we do a spot check, and we can tell that resident had been incontinent in their briefs for a while and it hasn't been cleaned or addressed, we are going to pull you to the side and ask. You're also going to be responsible for reporting all injuries and safety concerns. The IR 624 is a state form. We're going to go over that a little later, but make sure that you report any concerns or injuries to your med tech. So next we're going to go into hand washing. And we're going to watch this quick video.
Hi, my name is Namali Stone, and I'm one of the CDC leads for the COVID-19 response in long-term care facilities. Today, we are going to talk about how clean hands combat COVID-19 and discuss some key points for understanding the role of hand hygiene in COVID-19 prevention. This is part of the key COVID-19 prevention messages for frontline long-term care staff. The residents you care for in nursing homes and assisted living facilities are the most vulnerable to COVID-19 infections. Because of their age, frailty, and chronic medical needs, nursing home residents are more likely to have severe illness leading to hospitalizations and deaths. 8 out of every 10 deaths from COVID-19 have occurred in adults over 65 years of age. We all must take action now to protect them. You've probably heard a lot about hand hygiene before, but did you know that nursing staff can touch up to 15 different surfaces during a single care interaction? That means an average nurse working with 5 residents each hour would be expected to touch over 900 surfaces during a shift. Viruses like the coronavirus causing COVID-19, bacteria, including C. diff, and other germs can all be spread from our hands to our residents, their care equipment, and other surfaces in the room. Cleaning our hands often during these interactions contains their spread. There are 4 important moments when you must clean your hands: before any contact with the resident or their environment, before every cleaning procedure, such as placing a urinary catheter or a peripheral IV, after handling soiled items or body fluids, including after emptying a urinary catheter collection bag, and after touching the resident or his or her environment. If you clean your hands at each of these moments, you will be doing your best to protect your facility. You've probably had many in-services about hand hygiene technique, but did you know that alcohol-based hand sanitizers are preferred by the CDC for most hand hygiene opportunities? Hand washing is recommended when hands are visibly dirty or contaminated, such as after caring for residents with infectious causes of diarrhea, like norovirus or C. diff. Why does CDC prefer alcohol-based hand sanitizers? Well, it's because they are extremely effective against coronavirus, influenza, and many antibiotic-resistant germs. In fact, studies have shown hand sanitizer is more effective than washing hands with soap and water. Why? Because the alcohol hand rubs and gels start killing germs immediately. These products are easy to use because they coat the surfaces of your hands and aren't relying on perfect technique or a certain amount of time. Also, you can put up hand sanitizer dispensers all over the building, at the bedside even, which is hard to do with sinks. And the good news is that hand sanitizers are less drying and less hard on your skin than constantly washing your hands with soap and water. We don't always think about it, but our nails can actually provide a safe space for germs to hide, away from the killing effects of soap or sanitizers. Although we all enjoy pampering our hands with manicures, people taking care of residents should really avoid artificial nails and keep their natural nails trimmed. That way, we aren't taking a chance that our hand hygiene isn't effectively getting rid of all the germs. We all use a lot of gloves during resident care, but we have to remember that while gloves protect our hands, they are not a substitute for hand hygiene. We should be cleaning our hands after every glove removal and making sure we don't accidentally use the same pair of gloves with more than one resident. We don't realize how much we touch faces, our hair, or our clothing during the day. So be mindful of what you're touching, and definitely don't touch yourself or reach into your pocket with gloved hands. Also, although we are trying to conserve our use of personal protective equipment, we should not be washing gloves with soap and water to try to use them again. So remember, clean hands protect everyone, you, your residents, and even your family. Do your part to stop the spread of COVID-19 by cleaning your hands frequently and reminding others to do the same. We are all in this together, and sometimes it helps to have a friendly reminder when we get busy. So Support your residents in cleaning their hands too, before meals, after toileting, and throughout the day. If they have clean hands, then everything around them also stays a little cleaner. Bring your good hand hygiene practices home as well, so you, your family, and your community all stay safe. Here are links to a variety of resources available on the CDC website. They provide more information about COVID-19, additional guidance, and tools. Thank you.
So a key takeaway from this video, did anybody catch it? Also help your residents to wash or sanitize their hands. We probably often don't think about it, but they, especially in the memory care, are touching just everything that they could potentially touch. And then they're going down and they're eating their meals. And what do they do a lot of times? Because they're not quite for sure on how to handle a fork or what a fork's used for, they're going to use their hands. So we got to make sure that our residents are washing and sanitizing their hands as well. So hand washing, hand hygiene is the single most effective way to reduce the spread of germs. This protects not only your residents from getting sick, but yourself, and that will also help prevent your friends and family when you go home from getting sick. When should you wash your hands? So before you start your day, before and after lunch, and generally when you feel it is necessary. And wash them with soap and water. When hands are dirty or contaminated or soiled, we shouldn't be using hand sanitizer. So, like if we pick something up and our hands a little wet and we're not quite for sure what it was, or we know that we accidentally maybe touched a urine-soaked pair of pants, maybe while we're transferring a resident in a hurry, and we forgot to put our gloves on, right, which sometimes happens. You're going to want to go and wash those hands really well. You're going to also, if you coughed or sneezed or used a tissue or anything, you're going to want to wash your hands. And if soap and water is not available, you can use alcohol-based. Now, it says 60% or higher, but really most of our alcohols that we're using are 90% and above. So make sure you're constantly thinking clean hands, clean hands, clean hands. So before we get into all the little steps, we're going to do a little exercise. And even if I'm not in the room with you while this is happening, I want you to do this. So we're going to be feeling rushed throughout the day, and we're going to cut corners whenever possible to save time. However, hand washing should not be one of those areas. And the best way to make sure you're spending the appropriate amount of time while washing your hands is going to be by singing the ABC song. Now, while you're singing the ABC song, make sure you're putting your fingers around your wrists and you're, making a circle motion, back and forth by twisting your wrist in your opposite hand. Make sure that you take your tips of your fingers and your fingernails and put it in your palms of your hands and then switch and the tops of your hands and the bottoms of your hands and all that. So let's do it together really quickly, all right? And hand washing. We've already put soap and water on, and we're going to sing A, B, C, D, E, F, G. Get those wrists, L, M, N, O, P, Q, R, S. You're going to get the fingers and the tops of the hands. Q, R, S, T, U, V, W, X, Y, and Z. That's about 20 to 30 seconds, depending upon how fast you sing it. That's the amount of time you want to take every single time when washing your hands. So Step number 1, you are going to turn the water on and get your hands wet. Avoid hot water. Hot water will actually dry out your skin. It will crack it and make you more susceptible to germs like staph infections and so forth, okay? So you're going to apply 2 or 3 pumps of hand soap into your hands. You are then going to rub your hands together really well, make sure everything gets soaked up, and you're going to do this for 20 seconds, and you're going to sing that ABC song, or Happy Birthday. And then you're going to rinse your hands really good. And then here comes the next thing, is you're going to leave the water running while you're getting the paper towel. You're going to dry your hands really thoroughly with that paper towel. Don't use that paper towel to turn off the water. That paper towel is wet, and you could potentially still transfer germs from the faucet onto that paper towel and onto your hands and so forth. So you're going to throw that away, get another paper towel, turn that hand faucet off. Now this is extremely important because viruses such as norovirus and C. diff are highly contagious, and if for some reason, you got a germ transfer, you can recontaminate your hands or really contaminate the sink again. So just make sure that you're turning off that water with the paper towel. Then you're going to throw it away, and you're done. If you've got any questions in regards to these steps, please see us. So this little illustration shows how someone, can cough or sneeze on a bedroll or surface. The caregiver comes in, she touches said surface, and then doesn't think about it, and she touches her face. So the key point of this is try to avoid during the day touching your face, your ears, any parts of your body, because that's how infections also spread. Even though you're wearing your mask and you're doing all these fun things to protect yourself, it can happen very quickly if you don't think about it and you touch an opening of your body. So everybody, stop the germs and let's all stay healthy. You notice the family coughing and sneezing. What are they doing? They're using their elbow. So pay attention to that. Also, if you're sick, stay home. We don't want people calling out sick all the time. This is, if you're truly sick. Now, if you're sick of working, please still come in so that way we don't disrupt our residents' routines and days. But if you're sick, especially if you think you've been exposed to COVID, please stay home. All right, so this next little video is going to talk about how to keep germs out.
My name is Kara Jacobs-Slifka. I'm a medical officer and part of the CDC COVID-19 response in long-term care facilities. Today we're going to talk about how to keep COVID-19 out and the importance of not working when you are sick. This is part of the key COVID-19 prevention messages for frontline long-term care staff. The number one thing that you can do to keep COVID-19 out of your building and keep your residents safe: do not work when you are sick. The virus causing COVID-19 spreads mainly from person to person when they cough, talk, or sneeze. But some people can spread the virus even without having symptoms. So you should wear a face mask while you are at work all of the time. This is called source control because the face mask prevents germs from your mouth and nose from spreading to other people when you talk, cough, or sneeze, which protects residents and staff. CDC recommends the use of cloth face coverings for everyone who goes to public places for source control. These may be able to be used by some nursing home staff who are not interacting with residents. However, cloth face coverings are not considered personal protective equipment and should not be worn instead of a respirator or face mask if more than source control is required, like when you're caring for a resident. What we have seen so far during the outbreak is that COVID-19 enters into long-term care facilities through the people who work there. You could spread germs to residents and patients without even knowing it. And the added benefit of face masks is that they also protect you from germs by keeping germs from touching your mouth and your nose. In order for your face mask to work, you have to wear your face mask the correct way. Do clean your hands before you put on and take off your face mask. Wear your face mask so that it completely covers your mouth and your nose. Remove the face mask, touching only the straps. And if reusing the face mask, fold it in half with the outer part of the mask folded in and store it in a paper bag or breathable container. Don't touch your face mask or your face, and make sure that you don't pull your mask down under your nose. Your nose must be covered by the face mask. Don't wear the mask on top of your head, around your neck, or hanging off of your ear. And don't store the mask on your arm or in your pocket. You will need to take your temperature and report any symptoms each day when you start your shift. If you have a new or different cough, sore throat, shortness of breath, muscle aches, or otherwise feel sick, you should not work. Some people have even reported symptoms such as a headache, losing their sense of smell or taste, or chills. These could also indicate that you may be sick. If you feel okay to start your shift, but develop a temperature of more than 100 degrees Fahrenheit or start to feel sick while you're at work, you should immediately notify your supervisor and go home. Many nursing home residents have become very sick, and some have died after staff in their building worked while they were sick. You play a very important role in keeping residents and staff healthy. Anyone who enters a long-term care facility must first check their temperature and report symptoms. They should also wear a mask the whole time that they're in the facility. This includes you and all healthcare personnel, support staff, housekeeping, dietary, maintenance, construction, administrators, consultants, vendors, visitors, everyone who enters the building. No one should enter a long-term care facility when they are sick. Many people work at more than one building or have more than one job. If you become sick, you should alert your supervisors at all of your work locations right away so that they can check for other sick staff or residents who may be sick. COVID-19 can spread very quickly in nursing homes and in other long-term care facilities. There is no time to waste. You can be a voice for your residents. Help make sure that no visitors are allowed on site unless they are visiting during end-of-life situations. It is more important than ever that you help your residents stay connected by finding ways for them to communicate with their loved ones, such as over the telephone or using a video call like FaceTime. Keep your residents safe by encouraging other staff and anyone else who comes into the building to stay home when they are sick, clean their hands frequently, and wear a face mask. Encourage residents not to give hugs or shake hands. They should practice social distancing by staying at least 6 feet apart. And social distancing is for you too. Anyone working or providing services in the building should try to stay 6 feet apart from one another, including in the break room and in any common areas. This is how you can keep COVID-19 out, keep yourself healthy, and keep your germs to yourself. Your residents' lives depend on it. Hi.
So COVID-19, at this point, we are all familiar with COVID. We know what we should and shouldn't do, but as time has marched on, it's become a part of our daily lives where we get a little comfortable and relaxed, especially, once we're vaccinated and, everything else. but we still need to go back to the basics of making sure we're wearing the proper equipment in the proper areas at the proper times and hand washing. So the virus that caused COVID-19, as we all know, it started in Wuhan, China. Since then, the spread from China to other countries around the world, and is now considered, an epidemic on a global basis by the World Health Organization, also known as WHO. The most common reports of COVID-19 symptoms include a fever, dry cough, tiredness. In many cases, it's, very mild, runny nose, sore throat. A lot of people might not even realize that they have COVID. What we're experiencing right now in our buildings is the residents don't believe us when we're coming back and we're letting them know that they're COVID positive. At one point they might have some body aches, but for the most part, they have no signs or symptoms. And in severe cases, the virus, people develop, breathing difficulty, organ failure, they end up on ventilation. So, because we don't know how each individual person is going to respond to COVID, and even if you don't believe in masks and all that, we gotta do these steps out of respect for others around us, because we don't know how, at the end of the day, it's going to affect someone that we know or someone that we love. So, it's believed that the onset can be between 7 to 14 days, and that really depends upon the variant. So with the Omicron variant, what we're seeing is, typically within 7 days of exposure, if you're going to develop symptoms that are noticeable, it's around that 7-day mark, but sometimes it can be as much as 14 days. And if you're in close contact with a probable or confirmed case, please, 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 I cannot express this enough, let us know. Don't come into work, because it takes you thinking you might have been exposed and then later on finding out you truly were exposed. It's sort of spread through the building. And that's what happens. It spreads through the building, and it's not you and I that suffer at the end of the day. It's our residents. So if you think you've been exposed, we're going to probably ask that you take a COVID test before you come back into the building. And if you are positive, we're going to ask you to stay out of the building for at least 7 to 10 days, depending upon when the exposure took place. If you've traveled internationally, been on a cruise ship, maybe went to a party where there were some nurses there that work in the ER, and you weren't wearing your face mask, you're going to need to go get tested. If you live with people who have done any of these things, you're going to need to go get tested, because once again, at the end of the day, it's not you and I that are going to suffer the most. It's going to be our residents, because then we have to ask them to disrupt their normal routines, and many of them don't understand, especially if they're in our memory care. Make sure you avoid the risk. Avoid close contact with people. Stay 6 feet apart. If you're going to be in a group event, wear a mask, preferably a surgical mask, an N95. Not wearing your PPE properly. It drives me nuts to see people with the mask around their chin, under their nose. That doesn't effectively stop the COVID if it's underneath your nose. You gotta have that full face covered, your mouth and your nose. And then make sure you're washing your hands, you're using hand sanitizer. That's gonna help us cut down the risk. Also, encourage the residents to wear their masks, hand sanitizer, hand washing. Now, in memory care, it's really difficult to get them to wear the mask. If it's going to agitate them and upset them to a point where it's going to cause a behavior, please just let it be. At the end of the day, their mental well-being and safety is our number one priority. And that's why it's extremely important that we try not to cross-contaminate both the memory care and the assisted living units. General purposes of infection prevention and control. So recognize the early signs of COVID. So if a resident reports to you that they're feeling a little feverish, they got a little ache, a sore throat, report it so we can get them tested, and then we're going to probably isolate them from the others until we're able to get that confirmed. Ask them to also social distance, especially during an outbreak in the building. Respiratory hygiene, make sure they know how to properly cough and sneeze until their elbows, make sure they have hand tissues available, anything to help avoid that. Management of acute respiratory symptoms. So, if, your resident has tested positive for COVID and they seem to become more short of breath and things like that, please alert, especially if you're working the red zone, the med tech, so that way they can call the doctor. Maybe they need some inhalers. Maybe they are developing a pneumonia or a bronchitis or something from the COVID that we can treat, which will help control those respiratory symptoms. And then we're going to apply standard precautions to all of our patients at all times. Even during the summertime, we're probably going to be able to go back to wearing those surgical masks that we all prefer to wear, but we're still going to need to wear our mask. And then understand, what the precautions are. So we've got to always have this on top of our minds here. Contact and droplet precautions. You're going, well, what is contact and droplet precautions? So those are going to apply to our individual residents who have tested positive. So what that means is that we're going to, wear a mask N95. We're going to wear face shield, we're going to wear a gown, we're going to wear gloves. If we have them available, we're going to wear booties. We're going to spray our shoes down before we go in our homes or our cars. If we don't have the booties available, we're going to do proper hand hygiene, and we're going to clean shared equipment and all that other fun stuff. We're going to stay 6 feet apart when we can. The apron should be long sleeves or gown. Once again, N95 mask. We're going to do the face shields and so forth. And then disposable gloves. We're not going to reuse our gloves, and we're going to use that proper hand hygiene. So visitors and staff all need to follow the same protocols for contact and airborne and droplet precautions. So we're going to wash our hands, we're going to apply our equipment, we're going to do all that fun stuff. And then we're going to also, apply and take off in the same order every single time.